So Rajiv ji's case was very difficult and more difficult for us because there were problems at multiple levels, Cervical level was affected and there was radiation in the bilateral upper limbs where left side was more affected than the right side. Also on the left side there was significant muscular weakness that we calculated on the manual muscle charting before the procedure. Also there was problem in the lumbar spine at L4-5, L5-S1 levels, and there was significant pressure on the spinal cord and the exiting nerve roots. But then we wanted to avert operation because he's a young man, and we wanted it to avert it till the time we can, and combine the CArm guided block with comprehensive rehabilitation to achieve the desired goal. So we planned for transforaminal bilateral L4-5 and L5-S1 blocks. Then we did bilateral transforaminal for L4-5, L5-S1 block. We specifically did S1 root block for the patient and an interlaminar block at L3-4 level. So it was a very customized approach, and we placed the block very specifically at the desired places to achieve that desired result of reducing the inflammation, shrinking the disc, and reducing the pain by the nerve block. Then for the cervical spine, the major problem were already multi-level at the multi-level places. Like cervical, the 2-3 levels were affected, in lumbar 2-3 levels were affected. So in cervical, we planned for C5, C6 bilateral transforaminal block and C6, C7 interlaminar block. But whenever we are trying to picturize C6, C7, it is always difficult under CArm because the shoulder blade shadow comes in between while we are doing it for C6, C7 level. So we had to do the shoulder pull down approach, and we could place an interlaminar block at the C6, C7 level. So this was a highly customized approach that we achieved for my patient, and finally the pain was relieved, and the symptoms, the numbness and the feeling of pain and numbness that he was feeling in his left fingers was gone with time. So, and which was complemented with comprehensive rehabilitation. We started with the Williams regime and passive stretching to active stretching to resistive exercises, and now we are doing eccentric, that is extension, the McKenzie regime. So we are escalating our level of strengthening as well. So yeah, we have successfully averted an operation for a patient who was affected not just at one level but at multiple levels, and feeling the radiation in both the at both the levels, cervical as well as lumbar. And the condition in lumbar was such that earlier he was not able to stand for more than 10 minutes, and now he's running. So yes, the war is won.